her bio. Dr. Celia Hildebrand is a research assistant professor in the Department of Family and Community Medicine at the University of Arizona, Tucson, and a contributing faculty member of the Andrew Weil Center for Integrative Medicine. She holds a Doctor of Acupuncture and Oriental Medicine from the Oregon College of Oriental Medicine, where her dual focus was on the role of East Asian medicine in public health and its use in trauma response and recovery. Dr. Hildebrand has worked in the field of healthcare and environmental services for more than 35 years, the majority of which have included Native American communities of the Southwestern United States. Building opportunities and performance measures for interdisciplinary clinical education and practice is a critical focus for her academic work at University of Arizona. Dr. Hildebrand maintains a private practice in Tucson, is a past board member of Acupuncturists Without Borders, and in 2019,
this through the YouTube video later. I'm very, very honored to be part of this and very happy to bring this and the other people that were part of the series to you. It's been a passion of mine, and I will just say that I basically entered this medicine because I wanted to heal myself. I was born a long time ago, but I was also born crippled, and if it weren't for my mother, who insisted on not letting me have surgeries and only working with massage to work my bones back into place, I would probably not be the person I am today. I broke my back when I was 22, and that launched me into working with a lot of indigenous healers and a lot of non-traditional people, non-Western people. One of my very first teachers was a man named Mietek Virkis. He's from Poland, and he is a bioenergia healer from Poland. And so he taught me the sensitivity of the hands and the sensitivity of the auras in the fields around us. He also taught me Qigong. And that's really what launched me into this practice, really coming from my own maternal roots of this practice of energy work into Chinese medicine. So I became a masseuse, and then I became somebody who studied with other traditions and cultures, including Hawaii and Native American. And then they were the ones that taught me to go back to my roots. They were the ones who said, where do you come from? Don't just try to get our medicine, learn your own medicine. So I really came back to Poland and Ukraine and really sought out the healers. Still more to learn and more to find, I'm sure. Along the path, I also developed an interest in the Chinese medicine, and I studied it. I have a 6-year degree in Chinese medicine. I have both my master's and my doctorate, and I do have a clinical practice here in Tucson within a Western medicine clinic at the University of Arizona. So I am able there to blend both this Eastern and Western and some very traditional methods in the work that I do with people. I've been interested in this for a long time because I have seen how it works with individuals and with communities. And part of the work we do with Acupuncturists Without Borders is we gather people together, especially at times of war and natural disasters. And we train people, and we also then perform in these clinical settings and auricular acupuncture. And I will get into that towards the end of the presentation. But this is really my driving force for coming to Ushgarad when I did in 2019 and continuing to teach what I can and share what I can for the communities, but also for individuals. So I have a lot of slides. I'm going to go through them fairly quickly because I want to give you as much information as I can share today, and also give you an opportunity to ask questions at the end. So I'll start to share the screen. So in Chinese medicine, and we say Chinese medicine, but there's also Korean medicine, medicine from Taiwan, Thailand, Vietnam, and mostly we all have the same fundamental understandings of the elements and of the theory and the practice of this medicine. But for ease sake today, I'm using traditional Chinese medicine. So what I'd like to express and also encourage everyone is to think of this idea of centering. And we'll practice this move at the, no, really, we'll practice this move at the end. We should practice this move together. This ability to balance on one leg, but this is the ultimate, right? The ability to be in your centermost part of your physical body, so that you can completely be aware of what is external to you and not being impacted or affected by it. So it's this idea of being able to have courage to stand tall in the midst of disaster, and this capacity to witness, this deep well that we come from that gives us the ability to really witness at the same time. We're not participatory, but we're able to view it and witness what's happening around us. It's this idea of being centered so that we have the strength to persevere whatever is coming towards us, and being proud of what you do. One of the things that I always talk to my students about is that you don't, if you're in this medicine, be as good as you can be so that you would go to you as a practitioner, or you would go to you as a counselor, or you would advise your family members to go to you. Be as good as you can possibly be, so that you would trust yourself with yourself. And so I just kind of share that with you, because this is part of the self-care and the self-love that we really need to generate, especially at this time. How do we hold this balance and support to really be able to positively impact ourselves and our community? So as we think about the medicine today, I want you to think about, because we're going to talk about meridians and channels that go through the body. And every one of those has an entry point and an exit point. So I often talk about how we arrive at and exit any situation. How do you bring yourself fully to a situation and take yourself fully away without having the stickiness or sometimes the glue that happens when we're in really difficult situations with another person? So how do you maintain yourself? And we'll talk today about some very specific points, and I'll show you some points. I'll demonstrate some I cannot possibly demonstrate or I'll fall over, but we'll talk about where they are in the body so that you can find them later. In all of the East Asian medicines, yin and yang are the most fundamental concepts of this medicine, where we have this idea that yin turns to yang, and then it goes back to yin, and within each concept, and within each of these not opposing but complementary features is a homeostasis. Right when you see the darkness, this dark pattern coming, and it disappears. Now this is the most yin, and this is the piece of yang. Sorry, this is the piece of yin, the darkness that is within the yang, and you see it how it transitions here. So the idea of yin and yang is that there's always one relationship in response to another. So everything, everyone around us is a relationship to another. So this idea of yin and yang, yin is the feminine aspect of anything, of your body, of your emotion, of your function. And yang is the masculine. And we don't say it in terms of any kind of gender orientation, but really in terms of energy. That the yin, the feminine part, is the generative part of our lives, of our bodies, of our psyches. And the yang is the masculine part. So the yang energy we think of as something that gives us the power and the strength and the force and the function of an organ system, of an emotion. And the yin is the one that's going to be more receptive. It's going to be more quiet and dark. It receives information and it processes the information. And the yang is the part that takes that information into action. So there are these different attributes to both. And I point this out because many people have heard of yin and yang, but they don't really understand the importance of how one must transition to the other. If any energy gets stuck in the process of moving from yin to yang, there is this disharmony. And as an acupuncturist, I'm going to try to identify that disharmony and smooth it out and harmonize the system, harmonize the body, harmonize the emotions. Part of what we'll talk about today is how you can do that as well. We have 5 elements found in nature, and as the ancient Taoists used to talk about, also in our bodies. So we have these elements of wood, fire, earth, metal, and water. And I'm going to be walking through them in all of the slides, but it's the idea that, and I have to go back because when I was in the Carpathian Mountains in Uzhhorod, but also in my grandfather's village of Bugosha, over in Poland, And I saw where he grew up, and I saw the land that he lived in, and it was just surrounded by trees, and there was water running through it. There was an incredible pasture. And we were on top of, on the side of a mountain, so we could see down into the valley. And this is where it really came to me how similar the medicines are between East Asian medicine and also the Carpathian medicine and the medicine of Ukraine, which is this relationship of ourselves to the nature that's around us. And we know this almost intuitively in our culture. So I think of it as when I found Chinese medicine, it helped to explain a lot of the ways I grew up, a lot of the things that my grandmother taught me and my aunts, my great aunts, and my mother taught me. These things now begin to make sense to me in terms of Chinese medicine, but in terms of how I learned and how I came and how I am in the world. So these 5 elements, of course, there's water, which is related in our medicine, in East Asian medicine, to the kidney and the urinary bladder functions. The wood is related to liver and gallbladder. Fire is related to heart and small intestine. And these pairs I'm talking about, we call them the yin and the yang, the masculine and the feminine part of this paired relationship of function, but also of energy flow. Earth is related to stomach and spleen, and metal is related to lung and large intestine. Each one of these, this is a generative cycle. So I'll start at water, which is on the bottom left. The water element is really critical to flow smoothly through the body so that it can feed the wood. So if you don't feed wood, it becomes very brittle and dry. And the function of the wood element with liver and gallbladder is to be supple and to be resilient, so that when the winds blow, the winds being energetic, but also physically the winds, if the winds blow too hard and the wood is not supple and it doesn't have enough water in it, it'll bend, but it'll break. So we talk in this medicine about being supple enough that you can bend without breaking, that you have enough resiliency in your life. Wood has to burn to make fire, but it can't burn too hot or it creates forest fires and it destroys each other. It destroys our earth, it destroys us. So the fire has to be good and strong, but not too strong. And in the process of burning wood, fire becomes earth because it makes ash. And the ash nourishes the earth, but it also creates the earth, and as it's compressed, it creates metal. So metal is dug from the earth, and in that process, we find the water, the deep flowing water. This is a very Taoist tradition, but you can see that it's also very native, naturally based. This is a chart that I use often when I speak and when I teach, because every element also has associated with it, not just the organs, but an energetic sound, a capacity, maybe an emotion, we might say, a taste, a summer, a season, and also an emotion. So if you look at this, how this is presented, the element of fire, which we're about to move into, it's summer. We're almost at the zenith, right? We're almost at the summer solstice when the summer element is the strongest. Fire, heat from the sun, is going to be at the highest point. So we want to be in balance, or else our bodies and our emotions begin to go out of control. Fire is going to give way to earth, which is going to be the fall. Earth will give way to metal, which is mostly the winter. Metal gives way to water, which is the deep winter. And then the water is able to give way to wood, which is the spring. And so I'm not going to go into too much detail here, but I want you to see how this is a very generative cycle, and everything has to flow from the first and in the next. In many Native American cultures, we have directions, and we often talk about five or seven directions. So I just put this in context of also in East Asian medicine, there are directions of the north being metal, east is wood, south is fire, west is water. But in the center of all of this is earth. And that's important because we have to think about the stomach. We have to, and earth being the stomach and the spleen, we have to think about how we can generate enough energy from the food that we eat and the water and the liquids that we drink to actually help all of these other elements survive and be supple. So here's a really important slide because it talks about these channels in our body. And we have 12 main channels, meridians, and we also talk about them as rivers of life. They connect all the acupuncture points that run through and around and over and inside of the body. There are 365 points that we all have to memorize and know their functions and know their names. And we have to know how deep we can needle and what else we can do with these points, because we don't always needle. What I'll show you today is some of that is the massaging of some of these points. So it's these rivers of life that channel, literally channel chi or energy through the body. And I teach in Western medicine all the time, and I rarely use the word chi. In fact, when I taught in Ushgadad, the doctors that I worked with that were translating and interpreting me live while I was speaking refused to allow me to use the word chi, because they said they can't describe it. They couldn't imagine what I was talking about. And so they didn't want to look silly trying to explain to their counterparts what the word chi meant. And I was at that time, I was not very good at explaining it, but now really how I explain it is that it is this elemental, it's an intangible, but a very obvious level of energy that we see in a person. We see it in their face, we see it in their eyes, we see it in how they speak. Do they speak loud? Do they speak very quietly? Are they very depressed? Do they have this sparkle in their eyes, or are their eyes really withdrawn? And we know today with the war in Ukraine, a lot of people are looking at us through these vacant eyes, right? They'll stare at you, and you know that, you almost get the sense that there's nobody home because of the shock and the grief and the dismay and the terrors and the traumas that they've been through. You can see in their eyes that there's really not a lot of energy of life. There's not a lot of vitality. So it is a tangible, very tangible aspect. And we talk about it as flowing through the body. So I'm going to stop talking so much and try to move into some points. Elements of water can be very deep and mysterious, but we cannot survive without it. It can flow freely, but if it doesn't, then it becomes stagnant, stinky, and it can become choppy. So here's the wood, and in the liver gallbladder context of the element of wood, we think about wood as being its growth, right? You can visually see something or somebody growing, and you can visually see when something is stunted or unable to flourish. But it also represents determination. I am going to stand here, says this tree. I am standing here, and I'm going to bend, and I'm going to be resilient. I can expand, I can grow, and I have flexibility. The element of fire brings us warmth and brightness, and it represents upward movement, because we all know that when fire burns, heat rises. And so that's what the fire does. But if it burns too hot in the heart, it scorches the heart. It scorches our energy. It scorches our elemental response to life. But it also represents this warmth and this capacity to love and be loved. And then we get to earth, which is all about nourishment and abundance and harvesting. But it also reaps, we also think about it in terms of reaping the fruits of our labor. And then also, how do we metabolize? How do we digest what's happening to us? And then we'll talk a little bit about element of meadow, which is this idea of turning inwards. This is the time of winter. So this is when we turn inwards, and we really contemplate, and we think about what's happened to us. We try to make sense of our world. And I think for many people that are kind of in this part right now, in the war right now, we see how this could be a place where people begin to get very stagnant. So, sorry, I lost the ability. Let's go. I'm going to begin by talking about the element of water, because I want you to see that these two meridians, the kidney and the urinary bladder meridians, cover 75% of our body. So this is really important in terms of flow of energy. And you can see on the kidney side, we're calling it it's the yin element of, it's the yin aspect of this element of water. But you can see that it starts at the collarbone and actually goes to the bottom of the foot. I want you to pay attention to how the meridians start, where they start and where they end, because these are really important points that I'm going to show you. We want to massage them on yourself, and you can massage them on your family members, because again, they represent places of transition from one element to the next, from one meridian to the next. And then the urinary bladder, you can see that it starts actually at the inner canthus of the eye, and it comes all the way up and goes down the back of the head, down the vertebrae, down the buttocks, and all the way down to the end of the small toe. So you can imagine that somebody who has back pain, or somebody who has headaches, somebody who has pain at low back or upper back, at the neck, people who have pain in their hips, in their legs, their thighs, and their feet. This is a really important meridian. And so you want to be able to take care of it by doing some massage. And these are the points we'll focus on for the kidney channel in particular. And these are points that will help people to literally metabolize water. So people that have a lot of lower leg edema or swellings, these are very good points around the ankle, on the inside of the ankle, especially to rub. And you can rub them just with your fingers and rub them in counterclockwise or clockwise. Counterclockwise we think of as kind of opening a point. Clockwise we think of closing the point or keeping it stable. So you can see that you can rub these points on the ankle, and you can also get to this point under the foot, which is called kidney 1, which is our grounding point. It's the most grounding point on our body, literally, because it is the point that puts us in contact with the earth. You can massage any point along the channel, but some other points that are very important is this point that's on the knee. So it's literally on the medial aspect of your knee. And all I do with my patients and with myself sometimes is I'll take my hands and I'll just do this kind of twisting motion, and then I'll come to both sides of the knee and I'll massage. I'll just massage from the top of the knee to the bottom of the knee. And I'll do it in a counterclockwise, and then I'll do it in a clockwise motion. And it's really calming. A lot of people with arthritis, and especially as we age, the knees start to get very painful. So it's a really good technique for yourself, but also for your patients and your family and your friends. These 2 points along the side of the belly button actually are really helpful to help reduce overall edema or water retention in the belly. And then these 2 points at the very top of the kidney, at the very end of the kidney meridian, which is actually at the collarbone, are just really, if you massage them yourself, you can feel how it kind of opens your chest. It kind of just, well, what it does actually is that it impacts the musculature of your clavicle, of your shoulder region. And so just massaging them helps you open your chest and breathe more deeply. I'm actually probably going to skip through this slide really quickly. The kidney energy we think about in Chinese medicine as being the essence of our entire being. So we're born with a certain amount of energy, essence, and how we take care of that essence as we live our lives through diet and exercise and mobility and thinking, and is how we retain or we kind of use it up quickly. So the kidneys we think of as being our powerhouses of the body, and the adrenal glands sit on top of the kidneys, so it becomes even more obvious that this powerhouse of the kidneys and the adrenal glands combined is what gives us the oomph in our life. But in our medicine, it also helps to keep people balanced and keep people kind of grounded, again, going back to that kidney 1 point. So people who have been through a lot of trauma or who have lived in areas where there's been war or destruction of any kind, and they have that startle reflex where people are like, oh my God, something happened, and it stays in our bodies. We have this visceral memory of sounds and things that impact us from outside of us that gets stored in our bodies. And so that startle reflex is often a place where things get stuck, because if you take in that breath and you never let it out, it stays in your body and it just chimes over and over and over again. So the important thing is to help let it go, is to help release it from the body. And some of the ways we do that is the massage of kidney 1 and also those points around the ankle. We think of the urinary bladder as the first line of defense. And I know when I was growing up, there was always that idea of, you feel something on the back of your neck, the hairs on the back of your neck are rising, and you have this odd sense, and you turn around because you feel like there's somebody behind you. In Chinese medicine, we think of this as part of this qi that's informative. It tells us what's happening behind us. It tells us what's going on. And it's our first line of defense, even in terms of immunity. It's the longest channel in the body, so we like to take care of it. And here are some points that you can use just on your face and on your head, and you can just literally massage them. And so, we've identified some of them as places where you can see anything on the face is going to help with a headache. These points that are right on the eyebrows here are really helpful for stress. And you can just massage them beginning in the middle of the point, the middle of the eyebrow, the inner part, this middle part of the eyebrow, and then just massaging it to the ends. And it really helps you in terms of stress, but in terms of anything to do with vision or visual acuity. And then we have these points on the back of the neck, this UB10, which is right back here at the bottom of the neck. If you just massage it, it really is very comforting to relax and let your whole head kind of drop just a notch, just to kind of give you some comfort. This point on the back, we call this the most important point, one of the most important points on the urinary bladder meridian. And if you kind of put your hands on your waist and you just feel where your thumbs go, your thumbs will end up almost exactly at this point on the urinary meridian. And so you can massage that point, and it relaxes the muscles that help you stay upright, but it helps to relax low back pain and helps to relax the neck as well. And then this point on the very end of the meridian, UB67, urinary, it's called Zhi Yin, helps us to transition and to kind of move energy out of our bodies and just be ready for the next step. Here are 2 points that are really important on the ankles, this kidney 6 and the urinary bladder 62. If you just take your ankles and you kind of do this twisting motion again, and you massage up both sides of the ankles, the malleolus on the lateral and the medial sides, it really helps to kind of bring energy down, and it's very good for people who have problems with sleep. Water moves the wood, and again, we're trying to build resiliency and keep the wood supple with the water flowing, or else you will break. And we don't want to do that. In the face of adversity, in the face of what's happening right now in Ukraine, we have to be strong for ourselves, for our family, and for our community. So how we do that with this medicine is that we look at how to massage the certain points on the liver channel and the gallbladder channel. And you can see that the liver starts basically right underneath the nipple, and it goes down through the abdomen, down through the inner part of the pelvis, and down the inner part of the leg, and it comes out at the foot. And the gallbladder, it starts at the liver, at the foot, and it goes up to the nipple area. And then the gallbladder meridian starts, you can see like at the side of the eye, and it goes, you can see how it goes up the head, crisscrosses the head a couple times, it comes down the side. This is a really important meridian for headaches. And both of them are also good for some side pain and some leg pain, as you can see, and also for digestion. These 2 points are very important on the foot, and we do a lot of massaging with them. In fact, if you think of trying to press this liver 3 point very deeply and you connect it to that kidney 1 point underneath, it's very good to massage, to hold that tightly together for any kind of a headache. And you can see, because of the channels that we just went through, it drains the energy from the head down to the feet, and it will often take headaches of literally a 10 pain out of 10, and it'll drain it down to a 2 or a 3. And that just takes like 30 seconds to 45 seconds just by pinching together this point that we call liver 3 and the point that we call kidney 1 at the bottom of the foot. It's very, very useful. So how you find this point, I cannot put my foot up here, I will fall over, so I cannot do this. But how you find this point, if this were your foot, if this were the big toe and this was the second toe, you kind of come back until you reach the crux, until you reach this point of, no, you don't feel, you feel the bone. Your finger stops because it feels the bone. And that's where the liver 3 point is. And you come up just a little bit, just come closer towards the end of the toe. And that's usually a very sore and tender point, and that's what you can do to massage. So there are these points again at the waist. Here we have this liver 13 point. It's very useful for problems with any kind of digestion, and also for emotional stuckness. People, they get stuck emotionally and find that they're just can't get out of a kind of a constant worry and a constant thinking and a constant anger and frustration. So these points at the waist become very important. And again, coming over to the gallbladder, you saw how it really is this channel that covers the sides of the head, especially. So if you or anybody else has some pains, a lot of headache pains, you can come about 1 inch above the apex of the ear, like where the top of the ear would be. You just come up and rub that, go counterclockwise, and you'll feel how it begins to release all of the muscles in the head. And then this gallbladder 25 is the same point, is very close when you put your hands on your waist again, and where your fingers are gonna find that kidney point. Move them forward a little bit and you'll find where the edge is of your rib cage, the last rib. And that can often be a really tender point for people who have back problems, but also who have problems with anger and digestion, bloating, poor sleep, insomnia. And then back to the points that are at the back of the head. Again, anything you can do at the base of the skull, just by massaging and pushing out, really helps people with headaches and neck pain. And then we have this point right here at the shoulder. And I mean, who isn't tight these days? Who doesn't do this? Who isn't on a computer, or who isn't worried? And we raise our shoulders and we stop breathing when we're worried. So there's this point, it's called gallbladder 21. And it's a really important point. We don't like to do it at all if somebody is pregnant or suspects that they're pregnant, because what this point does is often very sore, and you can find it. It's halfway between the I'll just say the acromion or the shoulder and right where your neck comes. It's halfway between that. And often if you press it, there's like a knot there. So rub it gently, go counterclockwise on it, and just encourage that muscle to relax. And what it does is it helps your energy of your body just sink. And it just relaxes, which is why we don't do it during pregnancy, because it can help sink the energy so much that the baby wants to be born. So we try not to do that. And then there are some points at the end of the toes in the gallbladder meridian. You can see we push them oftentimes, or you can rub them, go counterclockwise for headache, any kind of foot pain, vision problems, migraines, heat. If someone's feeling dizzy, it's very effective for that. I want to move into the heart because the heart is so important to us, especially those of us working in trauma and those of us working with anyone who's been involved with disasters, wars, have trauma just from childhood or from losing parents or grandparents at any point in our lives, family members. The heart, we talk about the heart as containing, literally holding on to our spirit and our Shen. So this is different. I don't want to get into the spiritual aspects of soul and spirit, but in Chinese medicine, we think of the spirit as being something that is contained within every organ of our body. Like I went back and when I talked earlier about every organ system, or every organ has this particular emotion to it. Well, that's kind of the spirit of that organ. But it's the job of the heart, because the heart we call the monarch of the body. And so the job of the monarch, the heart, is to protect all the other organs, and he's the monarch, he's the king. So he has to protect everybody. And the heart has to be able to contain all these spirits, all these energies from the body, and all the experiences of the day. So this is where the stories live. They're born in the heart, they live in the heart, and they emerge from inside of us. They emerge from emotions and our experiences and our beliefs. They can enter us, believe it. We believe it in Chinese medicine, also in a lot of the cultures where I work, and I think also probably in Ukrainian. One of the ideas is whatever you see, whatever visually see and experience comes into your eyes, and it goes directly into your heart. That's where they settle. So when you see beauty, when you see somebody that you love, when you see a beautiful sunset or a tree or a flower, you can feel that energy coming into you, and it kind of does go to your heart, and it kind of makes your heart a little expansive. So this is why we want it, and we need to protect the heart, because literally at night, the job of the heart is to bring everybody home, bring everybody into the castle. I'm the monarch, I'm the king. I want to bring all of my subjects into my castle and protect them at night. So people who have a hard time sleeping at night, we often think about as having an issue with the energetic feature of the heart. You can also have a structural or a functional problem with the heart, but sometimes it is just that there's worry and there's concern and there's anger and frustration and all these things that are just running through our bodies, and the heart literally can sometimes lose its capacity to hold all of it. And because of that, we think of the mind, body, and mental health is that together. There's not a separation for us in Chinese or East Asian medicine. They are connected. So if you have frustration in your physical body, in your daily life, if you have anger, hatred, fear, anxiety, it's going to absolutely impact your body. And this is how we think of it, that it does, is that the heart has to be able to cleanse it at night. Your liver actually has to be able to cleanse blood. That's what it does functionally. Well, the heart is responsible for cleansing the emotions every night. And of course, it pumps blood, and we have to think about what is blood made from. Well, blood is made from the food and the drink. And so if your body's having a hard time digesting this food and this drink, it keeps that blood a little thick. It keeps that blood harder, it has more substance in the blood. And the heart actually physiologically has a harder time pumping it if the blood is not well prepared to be pumped. So like there's this aspect again of the earth, which is the digestion, is feeding the trees, is producing enough, anyways, feeding the trees, and the trees are trying to take up both the water and also the nutrients from the soil and be able to burn well in this tradition of fire. So it's how all of these things are fitting together. A 6th century Chinese philosopher said that if the spirit is at peace, the heart is in harmony. When the heart is in harmony, the whole body is whole. If the spirit becomes aggravated, the heart wavers. And when the heart wavers, the spirit becomes injured. And so if one seeks to heal the physical body, one needs to regulate the spirit. And this goes back, if any of you attended Dr. Shizan's lecture yesterday about meditation, she really, really emphasized this idea of mind, body, and spirit coming together and being at peace. So this is absolutely a critical part of Chinese medicine. And we talk about heartbreak, heart attack, emotions that can really impact the function of the heart. And there is this idea, there is something called warrior's heart. It's been known since the end of it's been known since World War I. And it was actually even identified back in the 1890s, and it was called soldier's heart. And it was this idea of the soldiers, the warriors had seen so much damage and destruction that their heart physically broke. We often talk about that the heart channel, and you'll see this coming up very soon, actually ends at the tongue. And so we know that people who have been in trauma and who have been in shock often can't talk. And so they'll be like, I don't know if any of you have experienced shock or trauma. I have, and I could not talk. I couldn't believe that I could not force myself to talk. I almost couldn't even find the words, but I could not physiologically speak because it was like the cat had got my tongue. Something happened. So it can happen not just to those of us that see somebody in trauma or see a war or see somebody being killed, but those of us that hold people who have experienced that. We have that impact. It's called secondary trauma. And I'm sorry, I'm going to pass through this very quickly. So we sometimes can't process it either. So I want to show you these points along the heart and the small intestine meridian that can help pull this energy out of you, out of your patients, out of your family members. And you can see that the heart meridian actually begins very close to the armpit. It's like right underneath the bone. And that's an area, it actually goes a little bit underneath the armpit. That's heart 1. So that's where this meridian starts. And sometimes you just have to rub underneath your armpit to get this to relax. And it'll relax the channel going all the way down to the end of your finger. It goes down to the end of the ring finger. So you can do these exercises which help pull out anything that's stuck in this whole channel. And we'll go through a few of them. The other is the small intestine, which is also the fire element. And the small intestine channel begins at the end of your small finger and at the outer part. This is where the small intestine begins, and it kind of wraps up through this part of the arm, this part of the wrist, this part of the arm, and it comes up the elbow, and it goes up to the side, up the back of the shoulder, and it goes up again to the face and to the ear. This is just a little bit of a better description of where the heart starts and ends. I'm sorry, it's at at the inside of the small finger. I apologize, I got that. I often think of it as the ring finger because that's where the ring goes, and this is the ring that's around the heart. That's what we say also in Native traditions. So it's at the end, the heart ends at the inside of the small finger. And again, these are places that you can massage that really help to open up the heart channel. So people who have like even pain in the chest. I know my father actually, my father was having a heart attack, and I was able to get to him. He was in the other room, and I was able to get to him. We called 911. Of course, we had the ambulance coming. But while he was experiencing this pain, I was in his armpit, literally massaging that heart one channel, that heart one point, to help open the heart and help open this channel in his chest so that he could breathe better. And I believe that it did save him. It did buy him time. And we did get him in the ambulance, and he did survive that heart attack. Another one took him later. But I do believe that that ability to come in and just massage that point helped the heart function better. These are important points on the wrist and the hand that have to do with the heart. You can see this inner part of the heart 9. If you need to, just you can massage it very deeply and pull the energy out. And then this point on the wrist, we call it heart 7. It's just if you bend your wrist and you come in maybe about 1/2 of an inch or 1/4 of an inch, it's right there. It's on the inner side of the ligament. There's often a very strong ligament right there, and it helps people who are in distress, who have a lot of irritability or anxiety, heart palpitations. You can massage this. Again, you'll go in the counterclockwise motion. And then there's this connecting place, which helps us kind of come back to ourselves. And it's about 1 inch up from the wrist. And again, it's going to be on the inside of that ligament. And it calms the spirit. It helps to calm the heart rhythm and the rate. It often happens if people are in trauma and they can't speak. And it helps to reduce pain in the wrist and the whole arm. And the partner to this is the small intestine, and anywhere along the small intestine channel, you can massage to help with the shoulder, the upper back, the neck. This is very useful. And we have this one point, which is, we call it small intestine 3, and you find it by literally bending your hand. And you can see that it is at the end of this a lot of us have a very deep furrow right here. And if you bend your hand, it's at the end of that. And it's right at this very apex of that end. And if you massage it, you can pinch it. It's actually very, very useful for neck pain or neck stiffness, whiplash, low back pain, because the upper and the lower parts of the back are functionally and physiologically connected. So you can help somebody with low back if you push this. It's very good for headaches, dizziness, night sweats. And then because the small intestine channel goes up to the ears, it's also very good for earaches and tinnitus. This point, which is about 5 inches up from the wrist, right up from here, about 5 inches up, it clears heat from the heart because of the connection between the heart and the small intestine, but it's very good for headaches and stiff neck as well. Upper back, whoops, we moved right into gallbladder. Oh no, I wanted to talk about this. So you can see when we talked about the gallbladder 21 and this gallbladder, so this is gallbladder 20, 21, and then just below that is the small intestine point. So you can see that these areas are very ripe for you to just, when you're massaging people, if you think about the meridians that you're impacting, you can almost visualize how you're helping somebody to reduce stress and have this energy move out of their bodies. We're going to talk about the spleen and the stomach. You can see that they have a lot of impact, especially in the front of the body. Then they go directly through the stomach area and also come up to the head and go down to the feet. So that how we have to think about the stomach's function is to digest food. So also kind of energetically, how do we digest our experiences? And we know that when we are upset, our stomach usually doesn't digest well and it gets stuck. Food gets stuck in our stomach and it feels like a lead brick. Or we just can't eat, we're too nervous or we're too upset to eat. But when we don't allow our stomach to receive nutrition or nourishment, not only is it affecting our body, but it's affecting our spirit. The channel begins, you can see at the spleen channel begins at actually the outer part of the large toe, and it comes up, it runs up through the inner part of the thigh, and where it ends is in the chest. So one way that I always teach people how to find it is you hug yourself. You can hug yourself. And when you hug yourself, there's usually a point where your middle finger or your second finger or your last fourth finger is going to land. And right there, it's often really tight and tender. And that is really close to the spleen, to this spleen 21. And this point is really important for us to literally be able to digest and breathe, digest life and breathe. So you can massage that point again, just come in, you can do it counterclockwise and just help you relax. You can see that point, it's going to be right around the area of the lungs. It's going to help people take in a deep breath again. The other points to massage are on the foot, and this is the inner part of the foot. And these points are especially good, even though they're spleen points, they're especially good for digestion, pain, bloating, diarrhea, constipation, and menstrual cramping. And again, this is a really nice place when you have the foot in front of you, which I cannot do, or I will fall over and it'll be embarrassing. You can kind of do this stretching or this squeezing motion again on the foot from the inside to the outside and the inside and outside. And it basically twists the skin a little bit, but it helps to relax all the muscles all the way and just continue it up to the ankle, and it'll relax the whole foot. And really, as you're doing this, since we've already seen these other meridians, it'll relax meridians, the end and the starting points for so many meridians, the stomach, the spleen, the liver, the gallbladder. And it's just going to help people digest life better and also their food. This point is called spleen 6, is a very important point for water metabolism. Again, for anybody with lower leg swelling, this is very helpful. And also for anybody who has a lot of stress in their life. But you don't do this point. This is another one of the forbidden points for pregnancy, because it helps to stimulate actually the uterine channel, and it will stimulate contractions. So be very careful for anyone who thinks they might be or are pregnant. And again, this point on the knee, this is a very important point for digestion. So, and also just being able to metabolize your life. So again, this is a really good point at the bottom of the knee, where you can do the twisting motion again, or just rub up. And usually how I find the point is I just run up through the condyle, through the tibia, and my finger will stop right as it comes to this like turning point at the tibia. And it's often really sore on a lot of people, especially women after age 25. This is a very good point to use. So around the belly button, we have a lot of points that make sense that they'd be very good for digestion. So one of the things that my mother taught me, and then in Chinese medicine, I learned it as well. And in Hawaiian medicine, it's very present. So I have to think there's a lot of good in it, is these points that are right at the belly button. So there's this abdominal massage that you can do, which is so calming to everybody, babies included, but especially those of us under stress. And it really is just a clockwise motion of warming the belly. And it's just this very gentle rubbing. And sometimes what we do in Chinese medicine is we'll have people put a warm cloth here, and if possible, add some other layers over top of it, just maybe a heating pad, just to keep it warm for a while. And it increases circulation to the digestive tract for sure, but it also just helps relax the muscles of the abdomen, which relaxes the muscles of the diaphragm area and the whole lung and breathing. We talked about this 21, which is the embrace. It also happens to be very good for overall body pain. So here we are with the stomach meridian. You can see it's also a very long meridian. It goes from the foot all the way up to the eyes. It begins at right underneath the eye socket, and it ends at the second toe at the lateral aspect. So why is this important is that if somebody has headaches, you can push this stomach 45 point, and you can actually help to pull that energy out of the head. And especially effective for anyone who has a frontal headache, especially. So if the liver, that point that we talked about, which is right here, this liver 1 point, you can push that and connect it to the kidney 1, or you can also just start pushing this 45 point and also just work your way up the meridian, and it really will help drain that energy out of the meridian. There's a really good point for a stomach, it's called stomach 6, it's right at the jawbone. And so it's very helpful for TMJ. And then this point up here on the head is very good for headaches and eye pain and dizziness. Here's this belly button again. It's about this point is about 2 inches away from the belly button. And again, it's the single, well, we think of it as the most important point for intestinal disorders. So again, just coming back to the idea of rubbing the belly and relaxing all those muscles, and then you can massage across the belly button, and it just kind of put your fingers in there and massage. I think a lot of us are afraid, especially those of us over age 25 who have a little bit of extra flesh there. I think a lot of us are maybe afraid of touching our bodies because we really don't want to see how much extra we've gained. But it's really important, and it can help you lose weight because you're going to increase digestion and increase circulation. This is one of the most important parts of the points on the body. It's leg 3 mile. And what we've heard, well, in Chinese medicine, there's lots of stories about how these points came to be known and why they're called, why they have this name. And so what they said is that back in the day when the hordes of the military, the Chinese military were out on the marches, and they had to really march for miles and miles every day, that this point they discovered would give them more energy to be able to endure what they had to face for the next 3 miles or for the next part of their journey. So we say that it also strengthens the immune system, and because of that, it maintains overall health, and it's excellent for stamina. So we have a really good picture here about how you find that point. And it's often, again, it's often very sore on people who have any kind of lower body discomfort or knee problems. So you really want to massage it going in either direction, counterclockwise, clockwise, just get in there and massage it as best you can. And it will help the whole lower leg, as well as give you more energy. We talked about how to kind of pull the energy down. This is stomach 44. I use it quite frequently in my office to help with digestion, acid reflux, diarrhea, constipation, tooth pain, facial pain, anything. It's a very common and very well-used point to massage and kind of pull out from the foot. I'm going to go through metal because metal is really important. It's the element that we associate with the lungs. And because of that, we think about it in terms of grief because the sound of the lungs is sobbing. And so people that are sobbing or just stuck in grief can't get this grief out of their lungs. What? I'm sorry. I have to go. We have to stop soon. I'll keep going. Okay. So grief is healthy. There's a lot of things in life as we get older that we grieve, and in moderation, that is okay. But we need to be able to process it and move it out of our body. So here are some points. There are some the lung point begins right up at the inner part of the shoulder, and then it goes down all the way down the arm. It comes out through the thumb, through the lateral aspect of the thumb. So when people are stuck in grief, a lot of times I will just massage this part. I'll start at the inner. And so if you think about, this is also very close to the heart meridian. So if you think about massaging this area, you're also kind of massaging at the outer part or the front part of the shoulder. Just come down underneath, massage right underneath and get to that heart meridian as well. And then massage up here, and you're just going to come down. You're just going to run down this part of the arm and come out the thumb. You're very close to the heart, so you might as well come down and run out the baby finger as well. It helps to clear breathing and opens up the chest. And then the large intestine point actually begins at your index finger, and it comes all the way up. It actually comes, it does come all the way up the arm as well. We find it more coming lateral on top of the arm. And it also comes up, it doubles down around the back, and it comes up to the side of the mouth, and it ends at the nose. So again, this is a point which is really important, the lung 1, lung 5. Massage it on yourself. You can put your arm forward. Actually, it's how you do another way of finding it. Maybe isn't the easiest way in this shirt, you can't see, but you can find it if you have your arm sideways and you push your arm inward, you can find it right there. It's right where the crevice is going to be as the muscle meets your finger. You're going to feel it, and a lot of times it's very sore. So massage it, opens up the chest, it opens up your spirit to be able to deal with life. This point we think is incredibly important for anybody who is in long-term grief. And the easiest way to find it is literally put your hands together like this and put your finger here. And right at the end of your index finger, you're gonna find like a part of your bone that feels like there's a tiny little hole. And right at that little hole is the space we call lung 7. So it's also very good for the beginning when you see early signs of a cold or a flu. And it also helps with coughing and improves memory, but it also for us also helps support the emotional expression. There are so many times I've done this point in a treatment and people will start to cry and they don't even know why, but they're just crying. And they're releasing this grief that's stuck in their heart. So there's a really good point at the inner aspect, again, of your wrist, which is for, it's called the greater abyss, because it's excellent. It's a deeper place where you can access energy for to stop coughing, sore throat. It's also really good for overall immune and very, very good to stabilize emotions and calm people down. So again, this twisting motion of just working on the wrist and just twisting the wrist can get these points, these heart, large intestine, lung points. And it just works really beautifully to relax it. And then you can just massage out the hand, just massage out everything in the hand and just pull it out. Get rid of that pain. We talk about this point right here at the fleshiest part of the thumb is especially good for sore throats. I've had to use this point a number of times on myself. When I have a sore throat, I don't know what's happening. I don't have access to anything else. Maybe I'm out driving my car and I start to get a sore throat. Maybe I've picked up a bacterial or a viral infection. And it really does help to clear the throat, but it also helps to ease the heart and support this tired heart. A lot of people use this point. It's called large intestine 4. It's junction valley. It hurts for most of us that use the computer a lot, but literally it's at the web. And if you push on it, it's supposed to help relieve constipation. I know a lot of people use it successfully. It doesn't work so well for me, but it actually, a lot of people swear that it helps with constipation, but it removes blockages. So, and it removes negativity in the body and the mind and the spirit. So you can see how, well, we want to get this unblocked. We want to move things out. We want to make things work better. And then this last point that we'll talk about is on right at the edges of the nose. And it's literally right at the edge of where your nose meets the outer tissue of the nose meets your face. And it's very, very helpful for nasal congestion, for runny noses, nosebleed. Pretty hard to do if you're a nosebleed, but it does work. Loss of sense of smell, and then any itching or swelling of the face. And you just, it's hard to rub it both at the same time. So rub one at a time, go counterclockwise, open up the nose, and then just, do the whole inner part of the nose. And just kind of open up your ability to breathe, to take in, to be inspired, to inspirate. Is that a word? But to bring in energy, bring in oxygen, bring in the experience, the good flavor, the good aromas into your life again, and let that go into your limbic system of the brain and stimulate that for the good memories. We all need that right now. We're almost at the end. I want to talk just a little bit more. I won't talk much more about grief, post-traumatic stress, and how TCM views it, because it's so critical to being able to let it go, to release it so that people can move on. I have a couple of slides next that talk about auricular acupuncture, auricular use of acupuncture points on the ear. But I want to just kind of lead you also to the work that's been done by Peter Levine on trauma, and you can access it through this website that will, I don't know if we're going to upload the slides as well, but you can find it through this website. So the ears are a microsystem of the whole body. This has now been incontrovertible. It has now been researched well through use of fMRIs and other measuring devices so that we see when we stimulate these particular areas of the ear, either by massage, but most effectively with needles, that we can actually have an impact on the parts of the body that are labeled on this ear. So you can see that there are parts of the body that relate directly to the lumbosacral, the lower back, to the hip, to the knee, to the ankle, to the thoracic vertebrae and the cervical vertebrae. And you see where this is on the whole aspect of the ear. This is really powerful medicine. I use it all the time in my clinic, and we especially use it when we are in clinical settings, community clinical settings, working with victims of disasters or victims of war, working with soldiers, people who have pain in their whole body. Sometimes they can't even sit quietly for a few minutes because they have so much pain in their body. So we can't get to any other part of their body, so we will work on the ear. This is a microsystem. I encourage you to come back to this slide a few times, look it over and over again, and you'll be able to see how there are specific points on the ear. And this is what I came to Ushkadai to teach, were these 5 points in the ear. And I've been talking with the doctors that I train, and a lot of them are telling me that they've been doing these points since 2019, and especially since February. And is having a remarkable effect on their patients right now in Ukraine and Uzhhorod, where they're able to help people calm down and relax and ease their anxiety and sleep better. These are the 4 points. I won't go into the details right now, but if you remember that these are points on your ear that you want to massage, and literally just massage the whole ear, and you'll find the benefits as you increase circulation to your ear and begin to stimulate the nerves that go directly into your brain. It takes a message to your whole body to calm down, to relax, to breathe deeply, to calm the nervous system and also the heart rate. And it works. I can't tell you how many times we've done it, thousands of times. And it just works. So just massage your ear, get on the inside of the ear, massage it, move your ear around, and you'll find this really remarkable benefit for yourself. Do this on your children that are anxious. Do this on the elders who are in grief. Do this on your family members who are just struggling, who have just escaped. Just do this. That's all you can do. Just massage your ears, and it'll bring relief and calm. I'm not going to go into Qigong. I've been practicing it for almost 30 years. I actually learned Qigong when I was in high school, and I was in a Catholic high school, and one of the monks at the Catholic high school had studied Qigong. And so he taught me meditation and Qigong. I was one of 3 students in the entire school that studied with him in one of the small rooms that we had, and we would practice Qigong every day, and we would practice meditation. And I learned so much just when I was a young person in high school, and I continue to use this work. I thought this was a really good video to share with you. It helps not only to create a sense of balance in your body, but a sense of putting your feet on the earth, of staying stable, of staying centered, of staying in contact with yourself, your body in relationship to yourself, but your body in relationship to everyone around you. And to be able to pull in the energy that is positive and keep out the negative energy. These are some very simple exercises. Check in with your body and the posture and your muscle tension. We all, by the end of the day, I think we're all kind of stressed by what we're facing these days. So check in consciously throughout the day, relax your shoulders, pull them down. Don't even pull them down. Let them just drop down so that you're no longer like this, but they're just dropped. Breathe deeply, lift your eyebrows, exercise these muscles on your face, and then remember to unclench your jaws. Roll your shoulders. I roll mine. I actually just do this exercise every morning and throughout the day, where I'm just moving my shoulder. As you saw, these are really important meridians. This is heart, lungs, small intestine, gallbladder. Everything is going through this upper chest that's important to stress. So even if you just do this 8 times forward, 8 times back, you're going to relax your shoulders, but you're also going to be stimulating your meridians and the ones that are important for keeping you resilient and strong through the day. So the sides of your body. So put your body straight. Don't do anything. Suck in your gut, because that'll help support your low back. And you can just put your hands above your head and lean to one side just a little bit. Just stretch very mildly and go back and forth. Come back to center and then go to the other side. And really, this just helps to keep those meridians open. These are the liver and the gallbladder. As you're moving energy through your abdomen, you're going to be stretching the stomach and the spleen and that urinary bladder in the back. You're going to be working these muscles and exercising them, moving the chi through them. And then just this idea of gently massaging your abdomen in a clockwise motion. It's basically sending love to yourself. It's a very nurturing experience for yourself, for your babies, for your loved ones. And then the massaging of your feet, ankles and legs, encourage that blood flow. We're standing a lot, we're sitting a lot, we're not getting a lot of blood flow to the legs. And so just keeping them supple by massaging them every day, especially at night. Or ask your kids to massage you, and massage your partners as much as you can. And then just plant your feet on the ground, wherever you are. Breathe deeply and connect your body to the earth. So with that, I have one more slide. I work with Native people. I worked with them for 30 years, sometimes exclusively. There have been years where I haven't come out of a tribe, and I've just been completely immersed with them. And I just thought that this is a really lovely saying shared by an elder in a community that I have not worked in. I work with the Pasquayaki tribe here in Tucson, but I have not worked with her tribe in particular. But I thought that this was beautiful. She's a curandera, so she's a healer of her people. And her message is to keep yourself connected to the outside world, to nature, in a way that supports you. And that you can receive back. Look at something beautiful every day so that you bring that into your heart. And we have this saying in Native traditions that we are trying to preserve the world, preserve the earth for 7 generations forward. And I turn this backwards and I say, I am the result of 7 generations before me. I am the 8th generation. I am the person that they survived to create. I am that person. If I don't do this, who will? And so I bring that forward to you because we are Ukrainians, and this is how we survive. We thrive and we survive. So this is the end of my presentation, and I just ask you, where will you take this?
Are you starting it?
No.
No?
And I'm happy to answer any questions.
Well, do you have any questions? Well, actually, I just wanted to make, well, to, oh, wow. Some kids are joining today. It's
I'm
great.
sorry, those are mine.
Well, first of all, I wanted to give a huge thanks to you, Celia, for an excellent and very informative presentation. Well, thank you for sharing your expertise and experience with us. And I do believe that these easy self-massage techniques you shared with us will really help us to maintain our health. And if so, the floor is open to questions from the audience.
May I just few words?
Yeah, please.
And first of all, thank you so much from me personally, because I always live in a professional world of researches, but my personal life was always with yoga and something more spiritual and qigong as well. So thank you for combining all 2 things that are important to me and bringing it all together. That is so nice that Fulbright surroundings is there. And if it's possible, I wrote it in the comments just to give us a few references on a book which you would recommend to start to go deeper in acupuncture and qigong, and so that would be really nice. And second, if it's possible, just because I know the world goes into practices that are evidence-based, and are there more movements in area of acupuncture and Chinese medicine that actually will help to make it more evidence-based, so major or majority of people can actually see it as an actually real medicine,
Yes.
let's say, or real treatment. You probably
Yes.
understand what I mean.
You know, when
Thank
I
you so
was,
much.
you're welcome. When I was in Uzhgorod, and I had to do a lot of lectures first, and I had to do them, of course, to the College of Medicine. There were probably 500 doctors in different lectures I did, and then also in Lviv. Every one of them, even he was the vice dean of the College of Medicine, said to me afterwards, we thought acupuncture was witchcraft. And it was like, oh, you admit, you said that. You said that out loud. But part of it was because I used so much evidence, and I will try to find that as we're talking and put it into the chat, so that I don't know, Jessica or Veronica, will there be a way that you can share this later?
Yeah, I will.
Okay.
Yeah. Mhm.
Okay. I will find a way. There are so many articles that I will send you. A lot of them have to do with fMRIs that are literally showing how the brain changes when you insert needles at certain points of the body, and also in the ears. And then there's the evidence of what happens when you put a needle through the skin. What does the body do about that? And where are you putting that needle? What is the chemical and what is the neurological response to a needle entering the body? And then there's other evidence on Qigong. And how there's a lot that talks about the increase of circulation of blood and lymph and nerve. And so, yeah, there's a lot. And you know what, maybe I will share my my email also, and you can reach out to me if I can't get you enough answers this way. Is that okay?
Okay.
Perfect. Thank you so much for that.
You're
Thank
welcome.
you so much.
Hi, Celia. Good morning. This is Sue. How are
Good
you?
morning, Dr. Tom. I'm fine. How are you?
I'm good. Are you in Kiev?
No, right now I'm still in Tucson. I'm hoping to head over in June.
Okay. All right. Well, thank you so much for such an impactful delivery of your presentation. I really enjoyed it. What a lovely way to start the day for me. So thank
Thank
you for teaching us all these acupressure points. I'm wondering whether a recording would be available for the Pasquayaki tribe.
Oh,
Yeah.
we
Okay.
it'll be on a YouTube channel, and so we could share that link with you.
Okay. Thank you so much. I hope to see you soon.
Thanks. See you soon, I hope too. Bye-bye.
Are there any questions from the audience to Celia? Well, actually, I have a question for you. Well, you know that going to the doctor when you're healthy is an obscure thought to those in the Western medical system. Should someone get acupuncture even when he or she is not sick?
That's a great question. You know, traditionally they think of needing to have needles as being one of the last things that you would do. Like usually the medicine talks about having a good life, having nutrition, having energy, doing qigong, exercise, good liquids in your body. And only when all of that fails do you turn to needling. And then you have to go to somebody else because you can't often needle yourself. So by the time you get to somebody else, it's the job of the acupuncturist to help harmonize whatever is out of balance. And even though you may feel that you're in balance, when we feel the pulse and when we look at the tongue, a lot of times we'll find underlying conditions, like the very beginning of something. So, and we'll ask you a series of really annoying, sometimes irritating questions that are trying to identify patterns of disharmony in the body. So we'll look for symptoms that you may not think are very unusual. We have this term, people have, because of so much stress in society these days, we have normalized things that are not really normal. So we talk about them as, well, you may have these symptoms, like a lot of people have gas and bloating after eating certain things. And we say that that's normal. Well, it's not. It's common, but it's not normal. So we try to reframe it and help bring people to this idea of keeping track of what is happening in their body. So I guess the answer is yes, coming to an acupuncturist to use needles to help stabilize or harmonize or put things back in balance is a really good thing, because it will help the smooth flow of qi, but it also gives an extra set of eyes of feeling what's happening by feeling your pulses, by looking at your tongue, by asking you these questions. We can see where things are beginning to go out of balance and maybe put them right before they get worse.
Oh, thank you very much. And well, are there any questions? Well, I have another question for you, Celia.
Okay.
Oh, this is my job, maybe. Who can have acupuncture treatment? Are there any limitations in terms of age, sex, or condition regarding acupuncture treatment?
In terms of, it depends on who's doing the acupuncture. So in China, I witnessed without problem babies having acupuncture, especially on the scalp, but they're held in their mother's arms. And part of that is to keep the baby stable. And also part of the scalp acupuncture was used for neurobiological issues or neurological movement issues, epilepsy and things like that, but not always. And so babies can have acupuncture in the right circumstance, especially with the right doctor. It's easy to do. But usually we don't start doing needles into children until age 12. We'll do other things. We'll do the massage and we'll do other things. And then up until death, acupuncture is performed. I have worked in hospice just in the past 3 years. I've had 5 patients die. So I've been with them as they died. So there are ways that we can use needles, but especially towards the end of life, we use more hands, more of the flow of energy to unblock things so people are more comfortable as they have to make a transition out of this life into the next. So, and it's very useful at all stages, male or female, no problems. And again, it depends on what your acupuncturist can do. We don't just use needles, we use cupping, which I meant to show a slide, because I know cupping is done in Ukraine. And one of my patients was came with a set of cups that when they escaped after World War II, or during World War II, they escaped with their cups and the clothes on the back. And so I was treating her with cupping, and she brought out these cups that they had brought out of Ukraine, which now almost 100 years ago, so they're 80 years old. And I use them today in my clinic. I feel so honored. And I use them the exact same way I use my Chinese cups, which is fire cupping. And we use that, of course, for back pain and for neck pain and for digestive issues and for immunity issues. So we do cupping, we do something called gua, which is a scraping of the skin. And we burn moxibustion, we burn herbs on top of the skin and with containers that are placed on top of the body.
It's interesting, great. Thank you. Are there any questions?
Wanda had something, yeah.
Wow.
So it was I know it was a lot. I apologize.
You put me in it's difficult to speak almost, such richness. But even though I've heard often and for years about meridians and points, as you were talking, I was curious about what constitutes a point and a meridian, and how does it relate to what we usually call physical aspects of our body? Or is it more this maybe not so physical energy of qi? And in Chinese medicine, is the fascia part of this?
That's a really good question. Clearly you've done some reading on energy work, right? And are you also an energy practitioner?
No, I've done the Donna Eden energy medicine, clearing of the meridians and stuff for years, and yoga and meditation, and I've received quite a bit of acupuncture and myofascial massage.
Okay. And I also want to, Veronica, I'm going to send you an email right now with a list of articles that I'm trying to upload and I can't get uploaded. So I'm trying to attach them to the chat. So hey, wonderful. 1 second, let me do that so I can make sure they get into the chat if at all possible. All right, Wanda, I'm going to come back to you. So the first question, or the first answer maybe, is yes, the meridians and the points are energetic. And that's why we call them like the rivers of life, is that they have been shown to be energetic, and that there are points that are located along the body. In fact, there was some, I'm also trying to find another really good book that I had a slide in this presentation that I took out, because there is evidence that as the baby, as the fetus is developing in the womb, at the same time as the nervous system is developing, there appears to be an energetic channel that is alongside or within this structural function, the structural piece of development, which is the nervous system and the bones and the muscles and the blood vessels. There appears to be something else that's developing at the same time. And so there is this new brand of research that's doing something with fetuses and babies as they're born to measure their capacity to understand and feel energy vibration. It's fascinating work. And it's actually, most of it's coming from Europe and not the United States. So, so the idea is that, yes, there are these meridians, and we see it in Chinese medicine all the time when somebody has had a surgery and a scar bisects or dissects through a meridian, and people have pain above and below, and especially at that point, and they can't always, they will often say that they don't feel like they're connected anymore. And we think in part it's because this scar tissue has formed around the meridian, and it blocks, it actually creates a blockage in the channel, so that we will go in and we will aggressively try to address it with needles, moxibustion, gua sha, and also laser. We're using lasers now increasingly on acupoints, because it's an energetic vibration that gets to the point without disturbing the skin as a needle would. But it puts in an electrical field or a light vibration into the point, and we're able to measure that as a distinct location for energy frequency. I don't know if I'm answering that exactly how you want, but we do recognize that the fascia represents a communication system through the body, as do the meridians. And so there is some research also that looks at whether the fascia is a giant, like a meridian itself, or whether it is just a conduit for the meridians. So, but we also know that meridians go deeper in the body. Like there are some places where I'll insert a needle, especially in the buttocks or the thigh, where I'm not on top of an organ. I can insert a needle to probably 3 to 4 inches, depending on the size of the person, before I actually get to the point. And there is a really tangible feeling when my fingers are on top of a person's meridian. There's a very tangible feeling that I have. And I was actually trained in Reiki when I was 23 years old, after I broke my back, and also by my teacher, Mietek Birkis, who did the bioenergy work. So I was trained very early, even probably as a child with my mother, but to feel the energy, to feel how a meridian is along the skin, and to feel when there's a lack of energy or when there's too much energy. And as your fingers get sensitive, you can feel that there's actually sometimes a knot, and physically there may be a knot, but sometimes there isn't physically a knot, but my finger stops and I feel it and I'm like, there's a knot. And if I put the needle in right there, or if I put the needle in where I feel a deficiency, so it's like almost a divot in the channel or a divot along the muscle, then I know I'm on a point. And if I put a needle in there, I'm also going to have an impact. And so there's places when you put the needle in, it feels like it's sinking into nothing, like there's a big black hole. And there are times when you put the needle in and it feels like you're heading into cement, and the needle grabs and you feel something on the end of the needle, and it's like it grabs it. And then you manipulate the needle and it begins to release and relax. So it's releasing not only the muscle fibers and maybe some of the circulation, the fibers of tissue. You know, though people usually know when you hit a nerve, they scream, but also you can feel how the muscles around that point where the needle's just been inserted will tighten, and then they'll release. And then you know that needle has made the impact that it needed to make in that part of the body. And then you can also trace it through the meridian and feel how it is on this end of the meridian and that end of the meridian. So maybe I've placed the needle right here, but I can feel how it changes, the tension of the skin, the tension of the muscles, the dermatome of the muscles itself, and I can feel how it has a reaction. And sometimes people will say, especially when I do points for the liver, where I mentioned that liver 13 and that liver 14, And it's a really fascinating point because it opens the chi to the whole body. And they will start to tell me that they feel the meridian, that they feel it in their eye. I won't tell them anything, but they'll start to say, I feel it in my eye. And I feel it, oh my God, it's going down my leg. And they will describe the meridian chain when I'm just putting that one needle in them and I'm manipulating it very carefully. And I myself have experienced it where I felt my whole face just go like that. And my whole face just opened when somebody did that point, that liver 14 point on me the first time. And it was like, I felt like it was a miracle. And then I felt it go down my body, all the way down to my foot. And then I understood the power of this medicine and the power of being able to get to the right point at the right time and do the right manipulation and release it. And that maybe all you need to do is that one point at that time, and you've released the whole body and the body's ability to harmonize itself and do what the body needs to do, which I don't even know what the body needs to do all the time, but I know I need to do this point. Does that make sense? No, just, oh no. And then who else? Also, Veronica, to you, you know, in Ukraine, what I'm told is that only medical doctors can do acupuncture. And that's the licensing. So when in Uzhhorod, what Dr. Pavlo Kolesnik, who was my host, we were able to create a certificate program for people who completed the training. And that certificate gave the doctors for sure, but also the non-NDs, the non-medical professionals, kind of a little bit of an umbrella for protection that said you had this training and this training qualifies under the School of Medicine to be, once you complete this training, you are qualified, in our opinion, to be able to do this work. So that was the strength of, I think, bringing Fulbright into the process and bringing me into an academic setting where we could do that. And the plan is literally to come back and do a train the trainer so that we can get more people in Ukraine trained to do this really important auricular acupuncture work. And then I will train the medical doctors that are interested and that can attend how to do scalp acupuncture and hand acupuncture and use other points on the ear to impact pain, reduce pain, and increase circulation and kind of do everything we can to especially support the first responders, the doctors, and the people that are enduring the war in every way possible.
Just wanted to thank you for all you do and continue to do for Ukraine. And well, are there any other questions to the presenter? Well, actually, we are running out of time, and I think that, well, just wanted again, Celia, to thank you very much for a very informative and really great conversation. And I do believe that our audience enjoyed your presentation. And thank you to everyone who has been with us and has been watching. Well, до побачення усім і гарного затишного вечора.